The pros and cons vary from person to person. There are different reasons why different patients might benefit from PD versus HD, but in general, PD allows more flexibility in terms of scheduling, and because it's a modality of dialysis that can be done at home, particularly in children, which I'm a pediatrician, so I take care of children that are on dialysis. Because PD occurs over a much longer period of time, it's much more gentle on the body and doesn't result in as dramatic blood pressure swings and changes in volume status. Oftentimes as well, for patients that live far away from a dialysis center, it's easier to do home dialysis modalities instead of having to travel to a dialysis center. Again, especially in pediatrics, there are only certain centers that are able to do dialysis on children. And so if a family lives far away from one of those centers, being able to do peritoneal dialysis allows them to do dialysis at home instead of having to relocate the family to live closer to a pediatric dialysis center. So the setup for peritoneal dialysis typically takes somewhere around 20 to 30 minutes for the time for the cycler machine to get set up and for the peritoneal dialysis solution to be primed through the tubing that will connect to the patient. So after turning on the cycler, the dialysis solution is put onto the cycler to warm up the solution before it goes into the patient. And a set of tubing is replaceable tubing is placed into the dialysis machine setup. After that has been calibrated and the tubing system has been primed with the dialysis solution, the patient will then be connected directly to the dialysis machine. This is a sterile process, so they has to be performed with sterile technique to make sure that to not introduce any bacteria into the catheter, which would increase the risk for developing peritonitis for the patient. So the dialysis catheter can be opened up and connected to the tubing that then connects to the dialysis solution. And then at that point, the cycler machine is able to run the automated peritoneal dialysis over the course of usually 8 to 10 hours overnight. There are several common obstacles that patients face when doing peritoneal dialysis at home. Number one, there's quite a bit of volume of supplies that are needed that have to be kept in the home. That includes boxes of dialysis solution, tubing, and sets that disposable sets that need to be changed out with every dialysis session, and as well as maintaining sterile technique when setting up the dialysis machine, as well as connecting the patient to the dialysis in order to minimize risk of infections. In order to do this, patients have to have a very strict protocol of training in which they review all the different steps of setting up the dialysis machine, as well as protocol for cleaning their dialysis catheter, maintaining their dialysis catheter site, and making sure that their hands are clean when they're doing all of this. Peritonitis can definitely be a more common problem for our patients, particularly pediatric patients, because kids and babies often don't know that they have to keep that site sterile, and so it's difficult for them to maintain their dialysis catheter without getting it dirty. Whereas you and I, as an adult, would know that we need to make sure to try to keep that area clean and keep it out of the way. A baby might be pulling on it, or sometimes even trying to open it up or chew on it, sometimes even we've had. And so because of that, peritonitis can happen more frequently in pediatric patients. We try to prevent against this by making sure that the family members that are helping to set up the peritoneal dialysis are well trained in looking out for the signs of peritonitis, but sometimes it can take a while for those signs to develop. And even with the best technique and sterile technique that they're observing, episodes of peritonitis can still happen. Early detection of peritonitis would definitely be very beneficial for our patients. With successive courses of peritonitis, that can lead to scarring of the peritoneal membrane, which can decrease the efficiency and the efficacy of peritoneal dialysis. For our patients as well, since they're often very young pediatric patients, they may need to be on dialysis for prolonged periods of time, or even if they have a transplant, further along in their life, they may need to go on peritoneal dialysis again. And if they had previously had issues with peritonitis, that may limit their options for dialysis modalities that they might be able to use later on. And so if we're able to identify episodes of peritonitis before we see the damage and the scarring that can result from uncontrolled infection, that would definitely be beneficial both for our patients in the short term and in the long term. The OpticLine would be a super valuable tool for our patients, providers, and everybody involved in peritoneal dialysis because it would be able to help to minimize the complications that happen from episodes of peritonitis. And by doing that, it makes everybody's life easier, reducing the burden of patients having to be hospitalized, having to deal with revisions to their catheter, and problems with not being able to do peritoneal dialysis. And it would prolong their ability to be able to do dialysis in the long term as well.